Dr. Arion. Senior Health Education.
One eye goes dark for a minute. Just one eye, not both. Not a headache, not a dizzy spell. One eye, and then, just like that, it comes back. Clear as day, like it never happened. And that is exactly the problem. Because when something clears up that fast, most people do something very human. They exhale. They shake their head. They pour another cup of coffee and move on with their morning. They do not call anyone. They do not write it down. They tell themselves it was probably just tired eyes, or the light playing tricks, or maybe they just need to drink more water, and then they go on with their day. And sometimes, not always, but sometimes, within hours or days of that quiet moment, a stroke arrives. Not as a warning, as the event itself. That is what this video is about. Not to scare you, but to make sure that if that moment ever happens to you or someone you love, you will know exactly what it means and exactly what to do next. Because that 1 minute, that single, painless, forgettable minute, can be the last clear warning the brain ever sends. If you are watching this for the first time, welcome. This is Senior Health Education, and this channel exists to give you the kind of honest, clear, medically grounded information that actually helps you protect your health and the health of the people around you. If this sounds like the kind of content you want more of, go ahead and hit the like button and subscribe right now. It only takes a second, and it helps this information find the people who need it most. Now let us get into it, because what I am about to explain could genuinely matter more than almost anything else you will hear today. My name is Dr. Arion. I have spent years working in vascular medicine, studying the relationship between the circulatory system and the brain. And one of the things that I have come to understand deeply, and that I want you to understand by the end of this video, is that the body almost never fails without warning. It sends signals, small ones first, quiet ones, brief ones. And the one we are talking about today, one eye going dark for 60 seconds or less, is not small in terms of what it means, even though it is small in terms of how long it lasts. It is one of the most specific early warning signs in all of vascular medicine, and it is one of the most ignored. Let me tell you why it happens. And I want you to picture this as I explain it, because once you see the anatomy, the warning makes complete sense. At the back of your eye is the retina. Think of the retina as the screen that receives all the visual information your brain then processes into what you see. That screen is extraordinarily sensitive, among the most metabolically demanding tissues in the entire body. It needs oxygen. It needs glucose. It needs constant, uninterrupted blood flow to keep doing its job. That blood flow arrives through a single artery, the central retinal artery, which is a branch of the ophthalmic artery, which is itself a direct branch of the internal carotid artery in your neck. Now here's why that matters. The internal carotid artery in your neck is also the main highway supplying blood to a large portion of your brain. The eye and a significant part of the brain are fed from the same source. They share the same upstream pipeline. So when something goes wrong in that pipeline, when a fragment of plaque breaks off from the wall of the carotid artery, or when a small clot forms and travels upward, it can reach the tiny vessels of the retina and temporarily block the blood flow. Within seconds, the visual field in that eye goes dim. Not blurry, not flickering, dark, or gray, or veiled, like someone has drawn a curtain across half your vision. It might last 30 seconds. It might last 2 minutes. And then the clot dissolves or shifts or the vessel reopens and the vision returns. Clear, completely normal, as though nothing happened. But here is what did not return to normal. The artery wall that produced that clot is still damaged. The plaque that shed that fragment is still there. The conditions in the blood vessel that created this moment have not changed. And the same pipeline that supplies the retina also supplies the brain, which means the next fragment that breaks loose might not go to the eye. It might go somewhere inside the brain, and there, it may not dissolve in 30 seconds. There, it may stay long enough to cause a stroke. The medical term for what happened to the eye is Amaurosis fugax. It is also called transient monocular vision loss. It is classified as a type of transient ischemic attack, a TIA, sometimes referred to as a mini-stroke. And while the word transient implies that it passes, do not let that fool you. Transient means the symptom passed. It does not mean the danger passed. Research is very clear on this point. In the days following a transient ischemic attack, including one that showed up only as a brief dimming of vision in one eye, the risk of a full ischemic stroke rises sharply. Some studies place the risk of stroke within the first 48 hours after a TIA at somewhere between 3 and 10%, depending on the individual's risk profile. 3 to 10% in 2 days. That is not a remote possibility. That is an urgent medical situation. And yet study after study shows that most people who experience these episodes wait days before seeking medical attention, if they seek it at all. They wait because the symptom went away. They wait because they feel fine. They wait because they are not sure it was really anything. That waiting is the gap where strokes happen. Now let us talk about who is most at risk for this, because understanding your own risk profile is what turns information into action. The people most likely to experience transient monocular vision loss as a warning sign of stroke tend to share a set of vascular risk factors. The first and most significant is age. Once you pass 50, the arteries have had decades to accumulate the kind of wear that makes this kind of event more likely. The smooth inner lining of the arteries, called the endothelium, has sustained years of stress, and in most people, some degree of narrowing and plaque formation has already begun, even without any obvious symptoms. The second risk factor is high blood pressure. Hypertension is often called the silent killer for good reason. It damages arterial walls steadily and invisibly over years, creating exactly the conditions that make clots more likely to form and break loose. The third is elevated blood sugar, including the prediabetic range. Chronically high glucose acts on blood vessel walls the way friction acts on a surface, slowly, persistently, creating roughness and damage that accumulates over time. The fourth is high LDL cholesterol, which provides the raw material for the plaques that build up inside arterial walls and eventually shed the fragments that cause events like the one we are describing. The fifth is smoking, which accelerates every one of these processes simultaneously, thickening the blood, inflaming the vessel walls, and dramatically increasing the tendency of the blood to clot. And the sixth, one that many people do not know to watch for, is atrial fibrillation. This is an irregular heart rhythm in which the upper chambers of the heart beat chaotically instead of in a coordinated pattern. When the heart does not beat efficiently, blood can pool and clot inside the chambers. Those clots can then be pumped out into the arteries and travel directly to the brain and the eye. If you are over 50 and you have one or more of those factors in your history, then an episode of one eye going dark, even briefly, even painlessly, even if it resolved completely, is not something to observe and wait on. It is a signal that deserves evaluation today. Not next week. Not after your next regular checkup. Today. I know what some of you are thinking right now. You are thinking about the emergency room. The wait times. The cost. The feeling of walking in and describing a symptom that is already gone, and wondering whether anyone is going to take you seriously or send you home with a bill and a shrug. Dr. Arion hears that concern regularly, and I want to address it directly. The discomfort and cost of an emergency room visit, even one that ends without a dramatic finding, is incomparably smaller than the cost of a stroke that was preventable. A full ischemic stroke, the kind that follows an ignored warning, can mean paralysis. It can mean permanent loss of speech. It can mean the inability to live independently, to drive, to cook, to remember the names of the people you love. The emergency room visit that feels unnecessary is the one that worked. Go anyway. Tell them exactly what happened. Tell them one eye went dark and then cleared. Use those exact words because they will communicate the severity clearly to anyone with medical training. And if the episode happened recently and you did not go, if you are watching this and thinking, that happened to me last week or last month, do not assume the window has closed. Call your doctor today. Ask specifically for an evaluation of your carotid arteries. Ask for a duplex ultrasound of the neck vessels. This is a non-invasive imaging test that uses sound waves to look inside the carotid arteries and assess whether there is narrowing, plaque buildup, or irregular flow. It is one of the most direct ways to evaluate the source of the kind of event we are talking about. Ask also about an electrocardiogram to check for atrial fibrillation, about a hemoglobin A1C test to assess your average blood sugar, and about your full lipid panel. These are the tools that map the vascular risk landscape and help identify what treatment or lifestyle changes are needed before the next event occurs. Now, beyond the eye symptom itself, there is a cluster of related warning signs that often appear around the same time or in the days leading up to a stroke. Understanding these companions and recognizing when they appear together is one of the most valuable things any person over 50 can carry with them. The first companion warning is sudden numbness or weakness on one side of the body, not the familiar tingling of a leg that has fallen asleep. This is sudden. It involves one side, one arm, one leg, one side of the face, or a combination. The nervous system is organized so that each hemisphere of the brain controls the opposite side of the body. A disruption in blood flow to one side of the brain produces symptoms on the other side of the body. So a sudden heavy or uncooperative feeling in the right arm and the right side of the face together suggests something happening in the left hemisphere. It may last minutes. It may vanish. But if it came suddenly and involved one side, the brain is what caused it, not a pinched nerve, not poor posture, not sleeping in the wrong position. The second companion warning is a speech problem. This can take different forms. The person might try to say something simple and find that the words come out jumbled or slurred, as though the mouth is not cooperating with the mind. Or they might hear someone speak to them and find that the meaning does not land, the words come in but the comprehension does not follow. Both are symptoms of a brain under vascular stress. Both can be brief. And both, when they resolve, leave behind not a clean slate, but an unanswered question about what caused them. The third companion warning is sudden loss of balance or coordination. Walking that suddenly feels unsteady, reaching for something and missing. A spinning sensation that arrived without warning. A feeling, as some people describe it, of being on a boat in rough water, even while standing still on solid ground. The back of the brain, the cerebellum, handles balance and coordination, and it has its own blood supply that can be compromised by the same vascular problems affecting the front. When the cerebellum is briefly starved, the body loses its coordination. Like the other symptoms, this can come and go in minutes. What makes all of these warnings so dangerous is not their severity, it is their brevity. They are easy to dismiss precisely because they end. The human mind is deeply inclined to use the resolution of a symptom as evidence of its harmlessness. If it went away, it cannot have been serious. But in vascular medicine, the symptom going away is not the signal that matters. The symptom appearing at all, however briefly, is the signal. The brain was, for a moment, not receiving adequate blood flow. That moment is the warning. The fact that normal flow resumed is not reassurance. It is a reprieve. Let me also speak about what is happening in the arterial system long before any of these warnings appear. Because the eye symptom and its companions are not the beginning of the story. They are the middle chapter. The story begins years or decades earlier, with changes that are invisible and silent and that most people have no idea are happening inside them. The inner lining of the arteries, that single-cell thick layer of endothelium, is one of the most important surfaces in the human body. It regulates blood flow, prevents clotting, manages inflammation, and maintains the smooth environment that keeps blood moving freely. But it is also vulnerable. High blood pressure creates mechanical stress that injures it. Elevated blood sugar glycates and stiffens it. LDL cholesterol infiltrates injured areas and begins to build up. The immune system responds to that buildup with inflammation. More material accumulates. Over years, these deposits, plaques, grow, harden, calcify, and narrow the vessel. And eventually, they reach a point where they are fragile enough to rupture, shedding fragments that become the clots that trigger TIAs and strokes. This process moves at the speed of lifestyle. Every day that blood pressure is uncontrolled, every day that blood sugar runs high, every day that LDL is elevated and untreated, every cigarette, every night of poor sleep, each of these adds to the pace of that process. And every change in the other direction, every day of controlled pressure, of managed glucose, of lower cholesterol, of movement and better sleep, slows it. The arteries are not fixed. They are biological. They respond to what they are exposed to. And understanding that gives you something more powerful than fear. It gives you agency. Physical activity is one of the most direct tools available for arterial health. Regular moderate aerobic movement, walking, swimming, cycling, anything that elevates the heart rate to a comfortable working level, improves blood pressure, improves insulin sensitivity, reduces inflammation, and directly supports the flexibility and function of arterial walls. The recommendation of 30 minutes most days of the week is not arbitrary. It is the threshold at which the evidence for cardiovascular benefit becomes consistent and meaningful. It does not require a gym membership or an athletic background. Walking is enough. Consistency is more important than intensity. Diet shapes the arterial environment in ways that compound over years. A pattern of eating that emphasizes vegetables, legumes, whole grains, fish, olive oil, and fruit, while limiting ultra-processed foods, added sugars, excess sodium, and refined carbohydrates, consistently shows up in the research as protective for vascular health. The Mediterranean dietary pattern has more evidence behind it than almost any other approach for reducing cardiovascular and cerebrovascular risk. It is also, importantly, not a short-term diet. It is a way of eating that most people can sustain, which is the only kind of dietary change that actually makes a long-term difference. Sleep is not optional in this conversation. Consistently getting less than 7 hours per night, or consistently poor quality sleep, is associated with higher blood pressure, higher blood sugar, higher inflammatory markers, and a significantly elevated risk of cardiovascular events. Sleep is the time when the body repairs itself, when the brain clears its own metabolic waste, when blood pressure drops to its natural baseline. Disrupting that process night after night accumulates a debt that shows up in the arteries. If you snore heavily, or wake frequently, or feel exhausted regardless of how many hours you sleep, those are symptoms worth evaluating. Because sleep apnea, which affects tens of millions of Americans, is one of the more under-recognized contributors to vascular disease. Stress, too, deserves honest acknowledgement here. Chronic psychological stress activates the body's threat response system in a way that was designed for brief, acute dangers, not for the continuous low-grade pressure of modern life. When the stress response is chronically activated, cortisol and adrenaline are chronically elevated. Blood pressure rises, blood sugar rises, inflammation rises. The behaviors that often accompany chronic stress, poor sleep, less exercise, more processed food, more smoking, compound every one of those effects. Finding consistent ways to lower the activation of the stress response is not a luxury. In the context of vascular health, it is part of the treatment. Now, I want to come back to the eye symptom one more time because there is a detail about the experience of it that I think is worth describing carefully, not as a diagnostic checklist, but so that if it ever happens to you or someone near you, you will recognize it without uncertainty. When the vision in one eye is affected by a temporary blockage in the retinal artery, the experience is typically described in one of a few ways. Some people describe a dark curtain descending from the top of the visual field in one eye, sometimes slowly, sometimes quickly. Others describe it coming from the side or rising from below. Others describe not a curtain but a gray fog, a washed-out dimming, a sense that the eye has lost its sharpness and contrast. Some experience a partial loss. Only the upper or lower half of the visual field in one eye goes dark. In most cases, there is no pain, no headache, no pressure, just the visual change, lasting somewhere between 30 seconds and a few minutes, and then a return to normal. The return to normal often happens relatively quickly. Not a gradual brightening, but a fairly sudden clearing, as though whatever was blocking the view has been removed. That sudden clearing is the moment most people feel relief. And it is genuinely understandable to feel relief. But Dr. Arion wants you to replace that relief with recognition. What cleared was the symptom. What caused it is still there. And the cause, a damaged artery, an unstable plaque, a tendency to form clots in the vessels that supply both the eye and the brain, is what needs to be found and addressed before the next event arrives. Because there will often be a next event. The body does not send this warning once and then fix itself. It sends it because something is wrong upstream. And without intervention, without imaging, without risk factor management, without medical evaluation, the same mechanism that produced the 5-second shadow in the eye is capable of producing a stroke in the brain. Not eventually, sometimes within days. If someone you know has mentioned this to you, maybe in passing, maybe as a small odd thing that happened last week, take it seriously. Ask them about it. Ask them which eye, how long it lasted, whether it happened before. Encourage them to get evaluated. People often minimize these episodes when talking to others because they do not want to seem dramatic about something that resolved so quickly. But minimizing it is the risk. The person who makes the call, makes the appointment, goes to the ER, that is the person who gives themselves the chance to prevent what comes next. There is something that Dr. Arion deeply believes about the audience that finds senior health education. The people who seek out this kind of content, who spend 10 or 15 minutes watching a video about stroke warning signs, are not passive. They are the kind of people who take their health seriously, who look out for the people around them, who want to understand what is happening in their bodies rather than just hoping for the best. That quality, that curiosity, that willingness to engage is genuinely protective. Health literacy changes outcomes. It changes what people notice. It changes how quickly they act. And it changes the conversations they have with their doctors because they come in knowing what questions to ask. So let that be what this video gives you. Not just information, but the specific knowledge of what to watch for, what it means when you see it, and what to do in the moments that matter most. If one eye goes dark, even for 30 seconds, even if it clears completely, that is a medical event. Get evaluated. Do not drive yourself. Call someone. Get to an emergency room or, if the episode has passed, call your doctor today and use the words transient vision loss in one eye. Those words will be understood. They will communicate the urgency, and they will open the door to the evaluation that can identify the problem before the problem becomes a crisis. If you have risk factors, blood pressure, blood sugar, cholesterol, smoking history, irregular heartbeat, age over 50, lower your threshold for action, not raise it. The higher the risk, the more important it is to respond to early warnings rather than wait for a larger one. And if none of this has happened to you, but you know someone it might be happening to, a parent, a spouse, a friend who mentioned something strange with their vision a few weeks ago and then let it go, share this with them. Send them this video. Have the conversation. Be the person who took it seriously when they did not. Before this video ends, I want to ask you something, and I genuinely mean this. Drop a comment below and tell me where you are watching from. A city, a state, a region, wherever you feel comfortable sharing. Every time those comments come in from across the country, from Florida and Texas and Ohio and the Pacific Northwest and everywhere in between, it reminds me of exactly who this work is for and why it matters. You are not just a viewer. You are part of a community of people who show up for themselves and for the people they love. I want to know where you are. Tell me in the comments. And if this video gave you something real today, if it made you think, if it made you pick up the phone, if it made you send a message to someone who needed to hear it, share it. Put it on your Facebook page. Text it to a family member. Post it somewhere it will be seen. Because somewhere out there is a person whose eye went dark last week and who is still telling themselves it was nothing. This video might be the thing that reaches them before the next event does. This has been Senior Health Education. My name is Dr. Arion. Take care of yourself, take care of the people around you, and we will see you in the next one.